Okay, I think I have given everybody permission, but for some reason you have any issues, please send a message through the chat feature to the Joint Information Center and I will get that fixed. We're joined this morning with Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Spitters. Each of our speakers will share an update, and after they've both shared their remarks, we will take questions using the chat feature. Please make sure to submit your questions to everyone so that all of our speakers can see. Thank you again for joining us. And with that, I will hand it over to Executive Summers.
Thank you, Heather. The next sound will be the dog scratching at the door wanting to get in. So sorry if you hear any strange noises. It's just Benelli trying to get in. So good morning, and just want to take a couple of minutes here to talk about a program that Snohomish County and our partners have been running really since almost the beginning of the pandemic. It's called Nourishing Neighborhoods. And the idea was pretty simple, pretty brilliant in its simplicity. When the pandemic hit and everything got us shut down, and if you remember, we had supply chain issues, there were several farms in Snohomish County that almost immediately lost their markets. At the same time, when Snohomish County's unemployment rate shot up to 20%, at the time, the highest in Washington state, there was really an immediate need to feed people. So Nourishing Neighborhoods created a program that saved the farms by buying their food and giving the food to people in need here in the county, thereby helping both. So it really married economic support and innovation to compassion. So right now, the program is averaging 3,100 boxes of food per month to support 775 families in Snohomish County, and the food is delivered to 25 locations across the county. So I really think about the kids who wouldn't have had enough food to eat and all those parents who struggled to put food on the table during the pandemic. So it's just been an amazing program. Nourishing Neighborhoods not only fed people, but also was a lifeline for many during a really difficult time. Food insecurity is a serious problem, and it's one that many of us never see, is often hidden. While most of our economies come back, there are still many who have been left behind. Nourishing Neighborhoods has been going strong every week since early last year, and we're going to keep it going as long as necessary. We're really grateful to all our partners involved in the program across the county. They're really incredible people doing incredible work without much fanfare to help relieve suffering, prevent illness, and help us to respond from COVID, the COVID pandemic. So a lot of thanks, very grateful community. If you'd like to see a short video about the program, it will be posted on our county's website, Facebook site, and Twitter pages shortly, and be available to you then. So with that, I'll hand it off to Snohomish Health District Officer, Dr. Chris Spitters.
Okay, thank you, Executive Summers, and good morning, everyone. Well, given the holiday weekend, our case rates and other charts that usually come out on Monday or Tuesday are going to be delayed by a day or so. So it'll probably be tomorrow before we get that data analyzed and posted. Preliminary projections, we're expecting that roughly 1,500 to 2,000 total cases from last week, basically a plateau in the weekly case count and the 14-day rate. But let's see what actually comes through. But that's kind of the the general sense we have. Hospitals still under tremendous strain throughout the state, region, and county. In Snohomish County, there are 107 COVID inpatients in acute care facilities, 30 on ventilators. The ICU's isolation rooms are running at 95% capacity, and the ICU's other rooms are running at about 80 to 90% capacity. The number of people in the ICU has gone up about 40 or 50% over the last week or so. And again, we'd like to remind you what Dr. Cook mentioned to us, and what we've seen and heard around the country is that most of the people ending up in the ICU with severe illness, mechanical ventilation, are indeed unvaccinated. On the vaccination front, 56% of all Snohomish County residents are fully vaccinated, leaving about 200,000 eligible individuals 12 years age and up who have not yet started their two-dose or one-dose regime. And then there's about 125 kids under 12 who are still not eligible. In recent weeks, I'd say about a month ago, the number of new vaccine starters, people going for their first dose, had declined down to about 3,000 a week. In the several weeks since then, it's gradually come up to about 6,000 a week starting vaccination, but that's still a small percentage of the total eligible and a small proportion of the total supply and system capacity that's available. So while, I'm sympathetic with healthy skepticism and understand some people's hesitancy about pursuing vaccination, I think we're far enough into the vaccine effort to really feel assured. I'm, wanting to assure everyone these are safe, effective vaccines. While not perfect in preventing infection, they remain highly effective at that, and even more effective in preventing severe disease. And so I encourage all of you who have not done so already to join the other roughly 500,000 Snohomish County residents who have completed their vaccination. If you're on the fence, talk with a friend, family member, neighbor, talk with your healthcare provider, same people you turn to when you have other health questions. A couple of reminders for you. We've still got very high level of transmission. Hospitals are under extreme stress and really having to look at triaging their care capacity. So we're really in a tough spot here. And I want to just remind everyone about the masking requirement indoors in public spaces. We also recommend that you wear masks when you're outdoors and can't either are in a large crowd or can't successfully stay a sustained distance from other people in the outdoor space that you're in. Also encourage people to dial back on gatherings that involve people that aren't in your household. And when you are indoors with people who aren't in your household, even if it's in a private setting and not covered by the requirement from the state and the county, we really encourage you to put a mask on, especially when you're indoors with unvaccinated individuals. Last reminder is about testing. As I shared last week, and then we followed up with a press release on Friday, we have closed the Linwood Food Bank testing site. The Everett location is open today, and the new Ashway Park and Ride site will open tomorrow. The Everett site, and again, that's near the Aqua Sox and Memorial Stadiums, will be open Monday to Friday, 9 a.m. to 4 p.m. And the Ashway Park and Ride will be Wednesday through Sunday, 9 a.m. to 4 p.m. We have another location opening up on the north end later this month, so stay tuned for that. And with that, I'll turn it back to Executive Summers.
Thank you, Doctor. First question is, the New York Times reports today that though Delta is more contagious, the chance of a vaccinated person catching COVID is between 1 in 5,000 or 10,000, and use data from King County as part of the story. citing there's been a lot of miscommunication about what the risks really are to vaccinated people. Your reaction, and I have a couple thoughts too when you're done. Doctor?
Well, we're still looking at the August data and analyzing that. But if you'll recall, when we shared a couple of weeks ago the data from July, that the incidence rate in vaccinated people for the month of July, when Delta was pretty much the only game in town, is about 80% lower than it is in unvaccinated people. So, for instance, I'm just making up these numbers, but let's say the rate in the unvaccinated was 100 per number of people over a period of time, then the rate in the vaccinated would have been 20. So that is remarkably lower. It's not that the gap between the vaccinated and the unvaccinated rates is not as great as it was before Delta, but there are other factors too that are at play there that we really haven't been able to tease out. Whether is this all due to Delta, or is it also time since vaccination? As most of us who have been vaccinated are now getting 5, 6, 7, 8 months out from vaccination. Notwithstanding all that, those numbers should tell us, that, wow, hey, 80% reduction, that's still very good. And so, and then the reduction in severe illness, like ICU stay in the hospital, is even further reduced. So again, safe and very effective in the preventing severe disease, and still quite effective in preventing infection, but not, as stellar as it was earlier in the course. Back to you, Executive Summer.
Yeah, I'd just say that it's quite clear that the vaccine provides a lot of protection, but it's not 100%. Some people still do end up in the hospital. The numbers are way lower, but we see that in the data. So it's a difficult message to nuance for the public. Some people might think that if you're vaccinated, you're 100% protected. Well, maybe yes, maybe not. And certainly you're much better off vaccinated than not. And so I have not seen the story. The New York Times will take a look at it, but clearly the best course is to get vaccinated, reduce your risk, and we'll just have to also keep going, looking at how long the vaccine remains effective and any new variants that come up. So next question, is the county going to mandate outdoor masking as King County has now done? Doctor, do you want to start?
Yeah, we saw, likewise, like you, we noted those orders last week, and there's certainly some merit in it. It's been shown, we've seen in Washington State, large outdoor venues, as well as other places around the country, have reported cases or even large numbers of cases coming off of large gatherings that nevertheless occurred outdoors. And so it does speak to the benefits, one, of masking up, as I said, when you're in a crowd outdoors, and the issuing a similar directive or order is under consideration in Snohomish County. And stay tuned. Later in the week, we may have more to say on that.
Okay, next, I'll just add to that. Yes, we're looking at both Pierce County and King County regulations and considering our alternatives on that. So we'll be getting back to you. There were reports of a critical care COVID patient being airlifted to Swedish Edmonds this weekend. Do you have any details about that, and if other patients in even harder hit areas are being brought here? Doctor?
I don't know about this specific instance, and that doesn't really. This is all about, to a great degree, preserving acute care capacity. Everything we're going through, and but we're not involved in a case by case situation there, like we are with other aspects of the control effort. Needless to say, the current hospital situation statewide, has led to this Washington's Disaster Medicine Coordination Center, working to find beds for people that need critical care when they don't have it in their own community. It sounds like that individual had to come from another community here. It's possible that the reverse could occur, and that's why we're all urging everyone to mask up, keep your distance, get vaccinated, and back away from the gatherings.
Is Snohomish going to follow what King County just announced? King County is working on vaccine verification requirements for some non-essential indoor business activities and other venues. Would go into effect in October. I'm not familiar with what they've announced on that, but vaccine verification.
Well, I know that has been under consideration, and it's a reasonable thing to consider. I think likewise we'll be looking at whether that adds to what we can try to achieve here in terms of mitigating the impacts of the pandemic on society and the healthcare system in particular. But I have nothing specific to report for you on that at this time.
Northern Idaho hospitals are going to crisis standards of care. How close are we to that in Snohomish County, and how worried are you will reach that level?
Yeah. Well, my sense from the health district's perspective is that we are close to that hospitals have been operating on what's called contingency plans. So there's normal when things are, everything's running fine and you're not really having to make any adjustments due to high occupancy. Then there's contingency, which is where the hospitals have been operating for many, many weeks now to accommodate these huge patient loads. But things really are getting stretched, especially with the increase in the number needing ICU care, staffing shortages. And so, if things keep going up, I think it's inevitable. My hope is that we get it under control and spare them and the community from that. But it's certainly a concern, and we all ought to be worried about that being a consequence of continued transmission.
Yep, I'll just say that I spoke with leadership at Providence Everett last week, and they expressed their highest level of concern they've had since, frankly, the pandemic started, and that they were essentially at capacity and had to add some sort of temporary capacity in their ICU unit, and we're able to do that, but certainly they're stretched thin. They were able to get some additional help, healthcare help at high cost, they said, but they are handling that. But we're very worried about any surges, and that an uptick would really get them into that crisis level of care. And so I think we're all concerned about it. We certainly are bumping along. The positive side of that was they said their discharge rate had been fairly level with their intake rate, although intake as you've heard in the numbers, has been increasing. So I think we're concerned about it, and we'll continue to talk with our healthcare providers and monitor that situation. So Stanwood doctors are inundated with requests for ivermectin. Can you speak again to your recommendation regarding that treatment?
Well, it would be funny if it wasn't funny. I guess, here we have an effective vaccine that we're having a hard time getting people to take, and yet people are, clamoring for a drug that's ineffective and potentially dangerous to take for COVID. So one, just to clearly state, multiple, the overwhelming preponderance of data looking at ivermectin as a possible therapeutic or preventive agent for COVID shows no benefit. And so you're only left with the risks of taking it. And we've, heard reports over the past month across the state of Washington Poison Control Center, hearing about people taking veterinary preparations and that sort of thing. So just one, don't do that. And two, don't bother your doc about giving you ivermectin. It's not going to help you, and it's only going to distract the healthcare system from dealing with your request, which is, while I understand the desire, it's not going to help you or anyone. So just give up on it, and instead more strongly consider something that's likely to work, like vaccination, masking up, spreading out from other people, and avoiding gatherings.
Next question, how did the county handle positive COVID tests among vendors at the Evergreen State Fair? Sounds like at least one tested positive last weekend. I'm not aware of any vendors that tested positive or anybody that worked there. I think we had one visitor that I'm aware of, but Doctor, you have an update on that?
Yeah, to the best of my knowledge, there was one who had worked at the fair, but I believe they weren't working at the fair during their infectious period. But it may be that over the coming week or so, the cases do pop up that are related either as patrons of the fair or members of one of the enterprises serving people there, and we'll handle that just like we would any other retail or employment-based case, and work with the employer and the individual and their close contacts.
I visited the fair yesterday and was very comfortable being there. The spacing was great, and the attendance was just, I'd say, just about right. We weren't huge crowds, but still people enjoying themselves. So I think we did a pretty good job. And my sort of gut estimation of mask compliance was pretty good inside the animal barns and that sort of place, the inside spaces. So it's about like what you see in the grocery stores. So it's pretty good. Let's see. John Hopkins data says the country's 7-day average of COVID cases is 3 times the number of cases we had last Labor Day. Are you worried for what the next couple of weeks will bring?
Well, of course, this whenever we have a major event, holiday, what have you, that foments people getting together, then we kind of brace ourselves for what's downstream. And especially now with the hospital so full, we just have no room for more cases. So yes, I'm very concerned and waiting with bated breath to see what happens, but hoping for the best. But that's hope is great, but action is in our hands, everybody. So again, remember everything we keep repeating: vaccination, masks, spread out, avoid gatherings.
We're expecting to hear a vaccine or negative test mandate from all sports teams in the state. And I think you're referring to the people attending those games. Are there other large events you'd encourage to do the same?
Well, as I said, for first, there's a lot of merit, and I strongly recommend everyone attending gatherings. One, think twice about whether you should be attending gatherings at a time like this. Frankly, I think they're best deferred, and whether those are get-togethers or going to a big event, it's a rough time to be doing that. If you do go indoors or outdoors, I suggest wearing a mask. And, as we said earlier in our Q&A here, that we're exploring additional options to strengthen COVID prevention in the county with these recent events in mind.
Yeah, as we mentioned earlier, we are looking at outdoor events and large events and criteria, and they differ from place to place, which we're taking a look at what is a reasonable standard for that. And I personally really support businesses, private businesses, to implement either testing or vaccination requirements. It's their right to do so. I would rather have restrictions on, so for example, self-imposed restrictions on indoor dining and that bars, that kind of place, the kind of venue. Rather go that direction than the shutdowns we had early on in the pandemic. I think it's a reasonable thing to ask people and totally within the rights of businesses. But again, the county and the health district are looking at what our options are there, and we'll be coming back to that issue. Any update, Doctor, on COVID deaths in Snohomish County?
Well, yes, I can tell you that as I always preface, the death counts are a little bit, they go back a little further in time. So we have complete death counts through the end of August. And the 4 weeks ending August 28, we had 31 deaths compared to just 13 deaths in the prior 4 weeks. So this number of deaths is much, higher than off our baseline. It's clearly related to this surge of disease. And fortunately, it's dramatically lower than the peaks in deaths we saw during the third and the first wave. Again, speaking to the fact that although there are some breakthrough cases and the vaccine is imperfect, but still very good at preventing infection, it's still quite good at reducing the risk of severe illness with ICU need for intensive care and death, as these numbers demonstrate.
See any other questions? I'll just remind you, you can really contact Rose at our Parks Department about any questions you have regarding the fair, Evergreen State Fair. Oh, a couple more. Oh, here comes some more. Have we seen any Mu or Lambda variants here?
Nothing to speak of. No, nothing coming up on the state's sequencing reports. And I haven't heard about any specific episodes either.
And next question, why this time go with self-imposed restrictions rather than mandates? We are looking obviously countywide. Again, different counties are imposing different standards. It's getting rather confusing. I personally think having some uniformity across counties and regions is important. And these restrictions in other places have been popping up. So we're taking this carefully and slowly, but again, really encourage and heartened to see businesses taking this seriously also. So certainly large events, these sports teams, I think that's a good move on their part. But again, we'll follow up and do something that makes sense and tries to reduce the confusion and variance between different places. Doctor, anything to add to that?
No, I agree. And I like you, I do support the notion of enterprises and businesses electing to require that their patrons be vaccinated for some services. Yeah.
Okay, that looks like the last of the questions this morning, so we'll go ahead and wrap up. As a reminder, please look for a recording from today's media availability and stay tuned for future media availabilities. Thanks and have a great day.